Hello everyone, welcome to EduTap and welcome to the today's top PIB news session on EduTap, in which we are going to discuss a very important report, that is the National Family Health Survey report. Okay, ji? So guys, when we talk about that, why exactly we are discussing this report? See, the reason behind that is this report is very important from the exam because it caters to the syllabus under the topic that is social sector in India health, and that is the reason that it becomes really very important for RBI Grade B and NABARD Grade A exam. So let's move on to the report. So guys, when we talk about this particular thing, then you can see here from the headline of the PIB that recently Union Health Minister has released the NFHS5 report, and apart from that they have also released a rural health statistics publication for year 2020-2021. So we are going to discuss all these reports in our today's session. So let's move on to the very first report, that is National Family Health Survey Report 5. So here you can see the national report of the 5th round of National Family Health Survey 5. So here you can see that this particular report basically provides us a detailed information on the key domains of the health and family welfare areas like the population, health, family welfare and associated domains such as the characteristics of population, fertility rate, family planning, etc. So when I talk about the very first round of this survey, this was basically held in 1992 to 93, one such value that you are required to remember from the exam point of view. So this survey is basically a multi-round survey which is basically conducted across representative households in India. Okay, now apart from that, why this is being conducted? This is being conducted in order to give requisite inputs to monitor and strengthen the existing programs which are being run by the government of India, and also to evolve strategies in order to improve those existing programs. And that's why when we talk about the objective of this survey, here you can see that its objective is to provide reliable and comparable data so that we can relate them and we can just find out that what are the shortcomings and what are the things that we are required to improve in order to improve these kind of parameters in our country. So when we talk about this particular survey, so this survey was basically conducted across 6.37 lakh sample households from 707 districts across India. So now when we talk about that, what is the data with which we are going to compare this NFHS5? So here you can see that NFHS4 estimates will be used as the baseline values for the large number of Sustainable Development Goal indicators, and this NFHS5 is going to provide data about 34 Sustainable Development Goal indicators at various levels. Now guys, all the basic part about this is very much clear to all of you. Now when we talk about the learnings from the NFHS4, so with the learnings of these NFHS4, NFHS5, for the NFHS5, Government of India has decided to assess the different parameters in the NFHS5, and these are the new dimensions which are being added to this. That is death registration, preschool education, expanded domains of the child immunization, then components of the micronutrients to children, menstrual hygiene, frequency of alcohol and tobacco use. Then we have additional components of the non-communicable diseases. But still, one dimension I have left here intentionally, and you are required to tell me as a homework question in the comment section that what is the name of that dimension. Okay, now let's move on to the key results of the national report progress for the NFHS4 2015-16 to NFHS5. Okay, so here the very first parameter is the total fertility rate, that is the average number of children per woman. So when we talk about the total fertility rate, it has declined from 2.2 to 2.0 at the national level. So here one more point that you are required to remember here is that there are only 5 states which were above the replacement level of fertility of 2.1, and the name of these states are Bihar, Meghalaya, Uttar Pradesh, Jharkhand and Manipur. So these are the things that you are required to remember from the exam point of view. Now when we talk about the contraceptive prevalence rate, so according to the report, there was increase substantially from 54% to 67%, and it was also seen that the adoption of the modern methods of contraceptives has also been increased. Apart from that, when we talk about the unmet needs of the family planning, it has declined to 9%, and when we talk about the unmet need for spacing, it has once again come down to less than 10%. So these are the important data that you are required to remember from the exam point of view. Now let's move on to the next important parameter, that is the pregnant woman who had an antenatal care visit. So when we talk about these visits by the pregnant woman in the very first trimester, so it has increased from 59% to 70% from NFHS4 to NFHS5, and the maximum increase was seen in Nagaland with a total difference of 25 percentage points. Now when we talk about the number of births, the number of deliveries in the health institution, so that is institutional births. So it was also seen that it has increased substantially from 79% to 89% in India. But here what is more important is, see, this number is also very important, but apart from that you are also required to remember that what exactly it was in the rural areas and what was in the urban areas. And here you can see that it was 87% in the rural areas and 94% in the urban areas, and there was not that long difference, the high difference between these few numbers of the rural as well as urban areas. Now when we talk about the vaccination coverage among the children, so the immunization of children aged 12 to 23 months has increased from 62% to 77% in the NFHS5. And when we talk about the full vaccination coverage, then it was basically 57% in the Nagaland to 95% in the Dadra Nagar Haveli and Daman and Diu. So this is basically the range, that what exactly was the range of full vaccination coverage as per the sample size in which this particular survey was being conducted. So now when we talk about the next important parameter, that is the stunting among children under 5 years. So stunting is basically what? It is basically low height for age. So when we talk about the data regarding the stunting, so it has marginally decreased from 38 to 36% for India, and it was basically high in rural areas, which was 37%, as it was 30% only in the urban areas. So when we talk about the lowest cases of the stunting, it was basically in Puducherry, that is 20%, and it was seen highest in Meghalaya, that is 47%. Now let's move on to the next important parameter, that is the prevalence of overweight or obesity. So it was increased in most states and UTs in the NFHS5, and among women it was increased from 21% to 24%, and when we talk about men it increased from 19 to 23%. See guys, these numbers which are being marked red here, they are really very important from the exam point of view, and that's why you are really required to cover them very holistically, because any data can be asked in the exam in the form of question, and it will basically give you positive marks in the exam. So I hope that these data are very much clear to all of you. Now apart from that, this particular survey also gives data about various other things like the use of clean cooking fuel, sanitation facilities and hand washing facility with the soap and water. And here you can see that all these numbers have basically increased. When we talk about the use of clean cooking fuel, it has increased from 44% to 59%. When we talk about sanitation facilities, it increased from 49% to 70%. And when we talk about hand washing facility with soap and water, it increased from 60% to 78%. That means India is basically going ahead in a good direction when we talk about these particular parameters. So now there were some women specific findings were also being mentioned in the NFHS5 report, which are also very much important from the exam point of view. So when we talk about the women specific key findings, it first of all tells about the participation of women in the 3 household decisions, and it was being found that women's which were participation in decision making was basically high. It was ranging from 80% in Ladakh to 99% in Nagaland and Mizoram. So in the rural areas it was seen 77%, in urban areas it was basically 81%. And what were these 3 areas? These were basically about healthcare for herself, making major household purchases and visiting her family or relatives. So these were basically the women specific key findings which were mentioned. But there is one more important point, that is about savings account that the women are basically having and using. So the relevance of that is that it has increased from 53% to 79% in the last 4 years, and this is what you are required to remember from the exam point of view. This is a very, very important point from the exam point of view, and it also caters to the topic of the gender issues which is mentioned in our syllabus. So guys, now as we have already seen that some new domains were added from NFHS4 to NFHS5. Now from the learnings of NFHS5, they have basically decided to add few more domains for the NFHS6, and these are the whole list of those particular domains which will be added in the NFHS6. For example, COVID-19 vaccination, marital choice, supplementary nutrition while breastfeeding, migration, then we have knowledge of the anemia, hepatitis B and syphilis, then we have utilization of health services, menstrual hygiene, digital literacy, and COVID-19 hospitalization and distress financing. So all these are the different parameters which are being added to the NFHS6. So I hope that this is very much clear and you can remember few of the names and you can use them while answering the descriptive answers in the exam. So now when we talk about some other changes in the NFHS6, so as per the government, when we talk about sample sizing and conducting the survey in urban area, it is going to use and adopt urban frame survey of NSO under the MOSPI, that is Ministry of Statistics and Program Implementation. So this is going to basically minimize the known sampling errors. Apart from that, when we talk about the rural areas, the updated list of villages from National Statistics Office will be used as a frame, and this is going to minimize the non-sampling errors once again. So I hope that this particular thing, the changes that we are going to adopt for the NFHS6 are also very much clear to all of you. Now let's move on to the next report, that is the Rural Health Statistics for publication 2020-2021. So when we talk about this particular report, it was once again released by Ministry of Health and Family Welfare, and it is basically a repository of different information that is about the health infrastructure in India, about human resource which is available in the public health institutions. Apart from that, it also helps us in identifying the additional resources which are really required for the better management of the public health delivery system. So when we talk about the important points about this particular report, here you can see that, as I've already told you, it was released by Ministry of Health and Family Welfare. So from the year 2018 to 2019 onwards, the data with respect to the urban health components have basically also been included in this publication. So now when we talk about the key findings from this particular report, here you can see that basically it tells us about the sub-centers, primary health centers, community health centers, sub-divisional, sub-district hospitals and district hospitals which are operational in India across our country. So these are the key findings which who has released this report. It has also been mentioned here. So all the important dimensions we have covered from these two reports. So guys, that was all from the today's session and from this particular report, and I really believe that all these kind of dimensions and the data are very much clear, and you are going to really answer the exam successfully, answering the questions about these particular reports successfully in the exam. So now let's move on to the homework question from the previous session, and you are just required to tell me that which ministry has signed an MOU with the SECI. And guys, here the right answer was Ministry of Home Affairs, and all those people who have answered the question correctly are the star performers from the previous session. So I am having a long list here, and if you also want your name to be mentioned here in the as a star performer in the next session, then you are required to answer this particular question, which is really very important from the phase 1 exam point of view. That is, you are required to tell me that who among the following has been recently appointed as the next Chief Election Commissioner of India. So do answer the question in the comment section, and I will be giving out your name as a star performer in my upcoming session. So guys, if you are still not subscribed to our YouTube channel, kindly subscribe it and press the bell icon to receive all the latest updates of the courses and videos offered by us. And you can also join our Telegram channel to get the access to the PDF of these sessions. To join the Telegram channel, kindly click on the link given in the description below. So guys, that was all from the today's session. I really believe that today's session was useful and fruitful to all of you. If you are having any queries, you can drop us a mail at hello@edutap.co.in, and you can also call us at 814-620-7241. So thank you for joining us. Wish you all happy learning.